Hello all. In this video we are going to discuss about transrectal ultrasonography. So transrectal ultrasonography is a minimally invasive technique where a specialized probe is inserted into the rectum to produce high resolution images of the prostate gland and also an adjacent structures which is often used for the evaluation of prostate biopsy guidance and also the Doppler assessment of the vascular regions. So high frequency probes such as 7.5 to 10 megahertz probe which converts electrical signals to sound waves for detailed imagings near the probe. So Doppler techniques also include three types. The first thing is color Doppler, which visualizes the blood flow direction and in the prostate lesion. And second thing is spectral Doppler, which measures the blood velocity in waveforms. And the third Doppler is nothing but power Doppler, which detects low flow of vascularity, which is useful for identifying hypervascular areas in cancer or in the prostatitis. Techniques for sonography is nothing but probes are endorectal probes with gel or lubricant which is being applied liberally. Insertion is gentle after a digital record examination to check for contraindications. Real-time scanning in transverse and sagittal plane assess prostate size, symmetricals, echo texture, seminal vessels and urethra. So supplement modes are nothing but elastography for tissue stiffness, contrast enhanced ultrasound for the nerve vascularity. So selection of sonography for transrectal ultrasound is nothing but it is chosen based on the indications such as elevated prostate gland, abnormal rectal regions, suspected prostate cancer, BPH, prostatitis, infertility, abscess. So Doppler modality is selected for the vascular evaluations such like hypervascularity in malignancy or inflammation. So transrectal ultrasound preferred over transabdominal for prostate due to superior resolution for probe proximity. So the general preparations of the patient is nothing but we have the clear bowel cleansing should be made by giving enema or a suppository for before 1 to 4 hours prior the examination to empty the rectum which will reduce the artifacts in the infection area or else to control the infection. And the second thing is nothing but we have to give the antibiotics if the biopsy is being planned. And medication the patient should stop aspirin, NSD medications and blood thinners as advised before doing the procedure. The bladder before starting the procedure, the patient have to empty the bladder and then the patient have to start the procedure. Clothing, comfortable attire should be wear and the next thing is no lotions or oils should be applied near the perineal area. So patient instruction is nothing but before starting the procedure we have to clearly explain the procedure to the patient for their possible comfort, and we have to intimate the patient that the procedure takes approximately 15 to 30 minutes, and we have to reassure about any low risk or quick recovery, inform the capron present and the option to stop if it is needed. And the next thing is we have to remain still. Breathing can be normally to minimize motion artifacts. The patient should not take a deep breath because it causes motion artifacts. Positioning, it is left lateral decubitus side with knees flexed towards chest is being mostly preferred position. Alternative position is nothing but lithotomy position, which is not the position which is nothing but the patient lies supine with their legs flexed and buttocks aligned with a table edge for probe insertion. So patient care and maintenance protocol is nothing but informed consent and address should be maintained before starting the procedure. The chaperone should be present during the procedure. Hygienic should be maintained, like a prop should be covered with a sterile sheath, disinfectant the probe should be completely disinfectant after the prior procedure has been completed. Strict infection control should be prevent to avoid any cross contamination. So we have to monitor the patient for any discomfort or vasovagal response or for any bleeding. And equipment, we have to regularly calibrate probe maintenance, and the quality check should be maintained before for the equipment. Post procedure is nothing but we have to monitor the vital signs, and we have to provide enough aftercare instructions, like we have to instruct the patient to be hydrated or to avoid any straining. So these are the aftercare that has to be given after completing the procedure. So clinical applications is nothing but for prostate cancer, this procedure will be done. Benign prostate hyperplasia, prostatitis, infertility, Doppler, and other applications such as brachytherapy, cryotherapy, HIFU guidance, and rectal cancer staging. So for these particular applications, this procedure will be done. So display methods and image quality, as it is informed earlier, real-time imaging will be displayed with the B mode imaging, Doppler overlays for flow of the vascular mapping, 3D or contrast enhanced for better visualization. Optimization will be done for best resolution, and the standard protocols will be maintained for the image quality. So this is how our urinary bladder or the prostate gland and the rectum will look alike in the images. So before starting the procedure, we have to give some assurance to the patient that this procedure is a minimally invasive procedure with no radiation exposure. It is safe, safely performed by a professional, and the procedure should be a quick procedure, and the patient have to be get the immediate imaging results. So the patient may feel discomfort or pressure during the insertion, but some lubricated probe and local anesthesia may be given to the patient to minimize the pain. So well tolerated with clear explanation should be given to the patient before starting the procedure. Thank you.